The SitAssist Pro positioning device can be used to lift or lower patients who need assistance prior to or after a diagnostic procedure. The SitAssist inflates to raise the patient from a supine position to a seated position with no manual lifting and minimal support from the caregiver. It can also be used to slowly lower a patient sitting upright to the supine position. Use of this technology reduces the risk of injury to both the caregiver and patient compared to the manual handling methods. This video will provide instructions on the proper use of the SitAssist. We will explain how to safely place the patient on the device and operate the system using the HoverTech air supply. The SitAssist is comprised of a two-stage inflatable chamber. The first stage of inflation cocoons the patient to provide stability. The second stage of inflation continues to raise the patient to a seated position. A centerline indicator is located at the top center by the patient's head. This indicator helps the user position the device on the procedure table and align the patient on the device. There is also a hip line indicator at the bottom edge of the device to help align the patient's mid-hip for proper placement. There are two deflation valves on each side located near the patient's head. One is a slow deflate, which provides adjustability of the SitAssist, and the other is a quick deflate for faster deflation after diagnostic testing is complete or in emergency situations. Attached to the bottom edge of the device is the securing apron. This apron extends under the buttocks of the patient to secure and stabilize the device. The apron also helps keep the patient from sliding down while the SitAssist is in use. The SitAssist has a patient weight limit of 600 pounds. It is constructed of heat-sealed nylon for durability and ease of cleaning. The HT-Air 1200 air supply is required to inflate the device. This air supply has the variable speed function necessary for safe operation of the SitAssist system. The control button for this function is labeled adjustable and is located on the far left of the keypad. Each press of the button will incrementally increase the airflow and rate of inflation. To stop inflation of the SitAssist, remove the air supply hose from the SitAssist valve or press the button on the air supply labeled standby. Please note that the standby button is not an on-off switch. Even though the airflow is stopped, power is still being supplied to the unit as long as it is plugged in. A 25-foot MRI hose can be purchased separately for use in an MRI environment. Using the centerline indicator as a guide, place the SitAssist device on the procedure table with the logo side facing up. If desired, linens or disposable covers may be placed on top of the SitAssist to keep the surface clean. Insert the air supply hose into one of the inflate valves and snap into place. Inflate the SitAssist by pressing the 34 hover mat button and have the patient get onto the table, making sure that the securing apron is fully extended under the patient's buttocks and legs. Ensure the patient is centered on the SitAssist. Position the patient's hips along hip indicator line and make sure that the patient is seated in the pocket of the SitAssist. To lower the patient to a supine position, open the slow deflate valve located at the upper right side of the patient head end of the SitAssist. Depress the flap inside the valve to slowly lower the patient to the table. Make sure to support the patient's head as the device deflates. To fully deflate the device, open the quick deflate valve. Close the deflate valve caps when the device is fully deflated. The SitAssist remains underneath the patient during the procedure. To ensure that the device does not interfere with imaging equipment such as MRI, CT, and nuclear medicine tables with moving parts, the caregiver can employ a hospital-owned securing strap. Tuck the sides of the SitAssist inward toward the patient. It is important to note that the strap should never be fastened when the device is inflated. After the procedure, insert the air supply hose into the inflate valve and snap into place to secure the hose. Press the adjustable button twice on the air supply keypad to initiate airflow. For patient comfort and safety, speed level 2 or 3 is recommended for use with the SitAssist. As the SitAssist inflates to lift the patient, the caregiver closest to the patient supports the patient's head to maintain proper alignment. After the patient is fully seated upright, the caregiver stops airflow by pressing the standby button on the air supply, then helps the patient off the table. The device can be quickly deflated by uncapping the red valve at the head end of the device. This can be utilized in case of emergencies. Use a facility-approved germicidal cleaner and damp cloth or a pre-saturated disinfectant wipe to clean the SitAssist and air supply between patients. Care should be taken to include hard-to-reach areas as the SitAssist cannot be laundered. Choose the SitAssist Pro positioning device to reduce the risk of injury to caregivers and patients who need assistance laying down prior to or sitting up after a diagnostic procedure.